The next Neisseria infection that we'll talk about is Neisseria meningitidis, which causes meningitis. The symptoms of Neisseria meningitidis are similar to lots of meningitis infections: headache, stiff neck, intolerance to light, fever. It is nearly 100% fatal if left untreated. However, mortality can drop to about 10% with treatment. This bacterium can also cause septicemia, so you'll have hemorrhagic lesions, disseminated intravascular coagulation, shock, destruction of the adrenal glands. Those lesions would look something like this. So this is a picture of the skin of a patient with Neisseria meningitidis septicemia. Humans are the only known carriers of the infection, and it's estimated that anywhere from 1 to 40% of people can carry this bacterium asymptomatically, particularly in the oral or nasopharyngeal areas in children and young adults. This bacterium doesn't have the same type of immune evasion that Neisseria gonorrhea has, and so we generally would see that the asymptomatic carriage would clear once patients develop specific antibodies. So as we get older and develop some antibodies, we may clear that carriage of Neisseria meningitidis that's more common in children and young adults. What we do see with this particular infection is that there is a high rate of spread in close quarter conditions. So dorms, army barracks, prisons. So those of you who have ever lived in the dorms, you may have already been vaccinated against this infection, and I'll talk about the vaccine in a couple of slides. Neisseria meningitidis meningitis is most common in young people, but we also do see it in the immune compromised and the elderly. Patients who are elderly, it almost seems a little bit counterintuitive. They've lived their whole lives. They've probably been exposed to everything. Don't they have a lot of antibodies? Well, your immune system starts to wane the older you get. And in fact, the bone marrow begins to be replaced by adipose tissue. So as you get older, you start making less and less immune cells. So that's why elderly patients are at higher risk for infection, even though you think, well, they've been exposed to so much. Yeah, they have, but now they don't have the memory of it. So this is a case of a previously healthy 18-year-old man who presented to the ER with acute onset fever and headache. He had a temperature of 40. He had a high heart rate. He had low blood pressure. He had a rash all over his chest, like a hemorrhagic type rash. The result of culture of CSF was not reported. Neisseria meningitidis was recovered in the blood. Despite prompt administration of antibiotics and other support measures, the patient's condition rapidly deteriorated, and he died 12 hours after arrival in the hospital. This patient illustrates the rapid progression of meningococcal disease, even in healthy young adults. This is one of those infections that when I first learned about it, I got a little bit like hypochondriac. I'm like, oh, my neck hurts. I wonder if I have meningitis. I just slept wrong. But when combined with a fever and a headache, it's something to take seriously, especially those of you who are younger than I am now. What you can do to diagnose this is you could diagnose using gram stain of the cerebrospinal fluid. So think about, what should normal cerebrospinal fluid look like? What would a gram stain of Neisseria meningitidis in the cerebrospinal fluid look like? You can test for some of the capsule antigens that are produced. Again, really commonly, you're going to do things like culture of the cerebrospinal fluid in the blood combined with microscopy. We don't see as high of antibiotic resistance as we see with gonorrhea. So there are a few more antibiotics that we can use, including some of the penicillins. And there are a handful of vaccines available against certain serotypes. When I lived in the dorms, we had to get the meningococcal vaccine before we could move into the dorms. And I know they recommend it for elderly patients as well. So if you ever are offered or hear about or have taken the meningococcal vaccine, that is to protect you from Neisseria meningitidis, whereas the pneumococcal vaccine would protect you from Streptococcus pneumoniae. So another thing to think about is if you were only given the option to do a gram stain of cerebrospinal fluid, how would you tell the difference between a streptococcal pneumonia caused meningitis and a Neisseria meningitidis caused meningitis? So these are the connections that you need to be making as you're preparing for this coming exam and the future exams in this class. You really need to think back and draw connections between all of the different species that we talk about.